This is The Opening Drive with Solomon Wilcots and Ed McCaffrey.
As we return, I'm now joined by Amro Albanna, co-founder and CEO of Aditxt Incorporated, who is here to tell us how knowing your immunity score could help provide a defense against COVID-19. Amro, right now, NFL players and staff are just like the rest of the U.S. population. They're faced with this binary choice of deciding between vaccination or non-vaccination. How can knowing my immunity score help me to provide maybe just another option for protection against COVID-19?
Yeah, Solomon, good morning. Look, in 2020, when the pandemic first started, the whole focus was on infection status. And that was understandable because we wanted to immediately, as a society, control infection. As we transitioned through that phase and as vaccination became available, the real focus now has to be on personal immune status. As you know, we're all different and everyone has different conditions and everyone has different immune system, and that immune system has a status. And moving forward right now, we must begin to pay focus on immune status, individual immune status, in order for us to make decisions based on each individual and their health.
Well, I want to quickly tell my story and how you and I met, because it was back in March that I received the J&J vaccination. And for nearly 2 months, I was walking around and thought that I was protected from the COVID-19 virus. And the people at Aditxt, they asked me to submit a small sample of blood just by pricking my finger to test and see if I had developed enough neutralizing antibodies to protect me from the COVID-19 virus. Well, the results showed, Amro, that I had a very low score, and it revealed that I wasn't protected at all. So then in July, I went ahead and I received a second vaccination. It was the first dosage of the Pfizer vaccine. And then 10 days later, I resubmitted another blood sample to Aditxt. And my production of neutralizing antibodies increased drastically from 18.6 to 283. As a result, I now feel certain and comfortable that I'm protected. So I want to ask you, is this a more prophylactic response or preventative way of using immune awareness?
Yeah, Solomon. So, look, your story is one of many, as you can imagine. These are exactly the cases that we're seeing over and over again, and it's basically common sense. Look, you are going to react differently than I would to a vaccine, whether it's one shot, two shots, or a booster shot. It's just simply common sense. And especially right now, we really do need to look at each individual immune status, just like your case, in order for you as an individual to make decisions as far as what to do next. So now, as you can see and as you can hear, the conversation about the booster shot is starting to happen. I believe it was the FDA or the CDC that yesterday they came out and they said, look, for immunocompromised individuals, they are going to recommend a booster shot. You know that the conversation will quickly transition on having everyone take a booster shot. So the question is, do we really want to do that, or do we want to make policies based on individual immune response? So you shared your story. Imagine you and others in your, in the same situation, walking around thinking that they actually do have a robust immune response because they got one shot, whether it's J&J or any other vaccine. But in reality, you really didn't have an appropriate immune response to deal with COVID. I'll share with you my story, if you don't mind. I actually, found out that I had COVID early 2020. So I developed immune response. I ended up taking 2 Moderna shots. So now my immune response is off the chart. You gotta see it where someone like myself may not need the booster shot, in comparison to others that may be immunocompromised. So really all we're saying right now, what we need to do moving forward is we have to understand each individual's immune response using AditxtScore to make an informed decision, they and their physician can make an informed decision based on their individual profile.
Yeah, there are people who, like yourself, who have had COVID-19 and they think that, well, I've already had it once, I can't get it again. But they don't know for sure if they've produced enough neutralizing antibodies to remain protected. And there's so much uncertainty right now, even with the surge of breakthrough COVID-19 cases and the need for, as people are talking about, variants and how it's going to be handled, whether it's with a vaccine booster. So I want to ask you, how does knowing my immunity score help to provide protection against this virus as it continues to mutate?
It will provide you objective information so you and your physician can make that decision. That's what it's all about. See, right now there's so much confusion, and we predicted that was going to happen. Actually, back in 2020, again, when everyone was focused on PCR testing and infection control, we were already predicting that post-vaccines, the focus and the attention is going to transition from infection to protection. So what we're saying right now, whether it's COVID, whether it's this variant or that variant, it really boils down back to your own personal immune profile to make that decision. So right now we're looking at COVID and 5 of its variants, including Delta. As it continues to mutate, we will continue adding to our AditxtScore applications to include these mutations. So back to really providing information for you and your physician to make that decision.
So now that my immune score is high, right, I have protection. Is that score constant, or what do I need to do to be sure that I'm maintaining enough neutralizing antibodies to stay protected?
Great point, Solomon. So this is really why we use the word monitoring, immune monitoring, because our immune system is not static. It's dynamic. There is continuum, and there is a range to our immune depending on what's happening, depending on what medication we're taking, depending on many, many complex factors. So at this point, and that's at a very high level, we're looking at Aditxt scoring people, and we're recommending once a quarter, every 90 days. Now, some situations may require more frequency, others may not. But really, we're introducing to the world the concept of immune monitoring, so you become aware of what's happening with your immune system. As you take a booster shot or as you take the vaccination, you understand what your immune system is like. And as you move forward with 6 months from now, 8 months from now, you'll see whether or not your immune system maintained that response, or whether you need a booster shot, or which we will be introducing, what we call cellular immunity, to begin to understand whether or not your immune system has developed a long-term immune or immunity for that virus and its variants.
Oh, that's very smart science. And again, you guys sent me a little kit. I was able to just prick my finger and submit the sample and ship it back to you guys. And you were able to score my immunity and tell me what my immunity status was. And it was good that I learned and got that information from you, because I'm now vaccinated. I feel that I'm very much protected based on you scoring my immunity a second time. We saw a tremendous rise in neutralizing antibodies. For our listeners right now, Amro, tell people where they can go to know their score.
So go to AditxtScore.com. That's AditxtScore.com. That's where the information is. They can contact us. They can get more information. And with that, Solomon, we really, truly appreciate you giving us the platform to get the word out. As you can appreciate, this is a major issue, not only in the U.S., but globally. And we really do need to get the word out about AditxtScore as a new approach and a logical approach to addressing this pandemic.
Well, I think a lot of people know that athletes, we tend to get the best health care because they always want to make sure we're healthy to get back on the playing field. And it's something that we've always been in tune to and learning the science of how we can best prepare our bodies to go out and compete and how to maintain our bodies to make sure that we're in the best shape possible. That's why you have a Tom Brady. He's got TB12. Other players are doing things. We've always been very in tune to taking care of our bodies and making sure that we have the best health. And I tend to believe that immune status and knowing it, I think, is vitally important as we continue to fight through this global pandemic. Amro, we want to thank you for taking the time to join us today, and we will continue to give out the website address if people call and want more information. Thanks again.
Thank you very much, Solomon.
All right, all the best to you. That was Amro Albanna, co-founder and CEO of Aditxt Incorporated. We will be back with more. We'll begin to talk a little bit more about what's taking place, what players like Kirk Cousins as well as Lamar Jackson, players that want to continue to be ready for their football team while also battling and dealing with the fallouts of COVID-19. We'll be back with more. You're listening to the Thursday edition of The Opening Drive on Sirius XM NFL Radio.